Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest, Dr. James Greenblatt. Dr. Greenblatt is a pioneer in the field of integrative medicine, an acknowledged medical expert, educator, and author. Dr. Greenblatt has lectured internationally on the scientific evidence for nutritional interventions with the focus of psychiatry and mental illness. His new book, Answers to Anorexia, Master the Balance of Hope and Healing, speaks about treatment for anorexia through prioritizing the correction of nutritional deficiencies. And Dr. Greenblatt has been working in this field for 3 decades. He is also the founder of Psychiatry Redefined, and that's the name of his website, psychiatryredefined.org. And we will have a live link so you can get directly in touch with Dr. Greenblatt on the archive of our show today. So thank you so much for joining us today, Dr. Greenblatt.
Ellen, it's good to be with you again.
Now, you have been involved in the field of what I would call natural medicine. The word integrative medicine, I think, is excellent. What does integrative medicine mean to you, Dr. Greenblatt?
You know, the term integrative medicine, to me, really utilizes all the best available science and clinical tools that we have to help patients suffering from mental illness. So there's no kind of right answer. We use medicines if needed, but our goal is to always look at the underlying cause and to support naturally when we can.
But why do you think, after being a physician so many years, when you were in medical school, which wasn't yesterday, you certainly were taught things like cycles where certain nutrients are needed for a cycle to continue appropriately. And yet then there's no discussion, even to this day, of testing people for their nutritional status and then supplementing when necessary. Why is that conversation not at the top of the list in medicine today?
Well, Ellen, I could tell you that's probably a question I've asked myself every day for 30 or 40 years, because some of the, as you're describing, testing for nutritional deficiencies and supplementing and treating those have dramatic effects on our health, mental health in particular, since the brain is the most metabolically active organ in the body, requiring these nutrients. Part of it, I think, is the culture. Our medical culture is around pharmaceuticals and surgery. And part of it is just the culture of thinking that our nutritional needs are met because we have such a full amount of food, but it's not nutrient dense, necessarily healthy food.
Wow. That is so true. You know, now as I'm in my later years also, I've been doing this since 1964 in terms of holistic and nutritional and natural approaches. And when I started, one of the pushbacks I used to get was, well, there's no evidence. It's not proven. But anybody who says that now looks pretty ignorant. I mean, any of our listeners can go on PubMed, for instance, and look up various nutrients, and you certainly are welcome to name some. They may want to just search on PubMed for yourself and see what they do in terms of brain function and also mood and balance.
You know, as you said, we've been in the field for a long time, and there's always been some research and common sense. But over the past 20 years, the research around the globe has really exploded in terms of understanding everything from the gut to a recent article published in the British Journal of Nutrition wrote an article on B12 deficiency and depression as if it was a new discovery. It just came out 2 weeks ago, but it's something we've been testing for 30 years, something I've been kicking and screaming, trying to get other doctors to test routinely. And an article comes out and it's all of a sudden okay to discuss it.
Exactly. But also what they'll do is if they don't promote that article, a year from now, they'll all forget that too. What I'm saying is it is time. The knowledge, the evidence, the safety of natural interventions, the fact that the side effects are that it helps something else. It might help your mood and your anxiety and your anorexia, but then it also helps your back pain. Those are the kind of side effects we have in natural medicine, and the other effects are often also positive. So why this is what I'm working for now. And by the way, we're making some progress here in South Florida, that natural and, integrative intervention should be standard of practice. That doesn't mean we get rid of drugs and surgery. There's a place for them, but it's much further along in the treatment protocol than first thing.
I agree, absolutely. And that's kind of what my career is. And we're devoted to training doctors so we can help, make sure that becomes the standard of care. Because not only is it effective, it is safe, there are no side effects, and it does something that at least the field of psychiatry has ignored since the beginning, addressing the underlying cause.
That is so true. And I had one nurse, Catherine Jensen, on my radio show. Oh, she was an RD, and she became the head of you would know what these kinds of facilities were like. It's for the criminally insane. So you don't get a much tougher crowd in a basically facility like was a jail. And she became the head nutritionist there. And she went in with the kind of knowledge that you have, Dr. Greenblatt, about nutritional deficiencies and their diet. And of course, the people who were in there were fed nothing but frozen food and sugar. And she changed the entire thing, where she brought in the community and had natural and organic food that was grown within a mile of this facility, which is way out in the country. She made deals with them to bring in their fresh food. She brought in the cooks at the facility and said, look, you have a full kitchen here. You're not going to only be microwaving frozen stuff. That's all they ever did. And she did that for 2 years. And then she got a lot of pushback, believe me, from everybody. The patients, when she took away Jell-O, they had a meltdown. But at the end of 2 years, she was able to document both decreased costs in the kitchen feeding all the inmates, and she monitored behavior and got much better behavior, much less aggression, much more, happiness scores just from doing that.
That's incredible. We have research from the 1990s in prison populations similar to what you're describing, looking at very minimal interventions. One was just a multivitamin and essential fatty acids with decreased aggression and violence. I mean, the public health implications of what you just described and what is available in the research for 30 plus years is just really mind-boggling that it's not implemented across the country and introduced as a public health intervention.
And for everything, for everything from pediatrics to, if we're talking COVID or viral infections or common colds and flus, to what you're talking about, which is severe imbalances that impact your whole entire life, such as psychiatric problems. And in this particular case, you talk about it in terms of anorexia.
Yes. We treat all major psychiatric illnesses. I think anorexia was easy 25 years ago for me to start talking about because everyone understood that they were malnourished, they were starving, and we could articulate and describe how that starvation affected the brain. I think now we can understand it across all major psychiatric diagnoses, from depression to anxiety to even schizophrenia.
Well, I know schizophrenia is a difficult one. And you, of course, are well trained. I have to say that I've seen people come to various natural clinics that they did have difficulty with because getting off those meds is really difficult. And sometimes the meds have allowed them to actually function versus being like in a padded cell. So I would say that's probably, a difficult transition rather than a place to start.
Oh, absolutely. But I think our current model of treating major mental illness like schizophrenia is just more and more medications with pretty significant metabolic side effects. And as we begin to explore some of the nutritional deficiencies or metabolic problems, the earlier we can treat, we've seen major psychosis completely reverse.
That's unbelievable what you just said. Major psychosis being able to be turned around.
Yeah, there are, we've B12 deficiency in an adolescent, very severe celiac disease. It had B12 deficiency, presented to the hospital with psychosis. If we didn't pick up that B12 deficiency, they would probably be on a path of multiple long-term medications. But lots of examples like that. And again, we use medications every day, so we're not saying there's not a need for it.
No, exactly. That's the integrative approach. I'm not again, as a nurse, PhD RN since 1973, I absolutely have seen medications be phenomenally life-saving and helpful. We don't want to throw them all out. It's just used incorrectly, I believe, because of the adverse effects and the cost, both individually and to society. And it's not always necessary. They seem to use it first thing. Even, of course, when I was a child, and I'm sure you remember, the first thing for any sniffle was a giant course of antibiotics. And that has caused that vast array of microorganisms that are resistant.
Absolutely, yes. The reflex in psychiatry is one medicine based on symptoms. Nobody's looking at underlying cause. And then if you're not feeling great in the next 15-minute visit, it's a second medicine or a third medicine. And, we see people coming in on 5 or 6 medicines that are still struggling, and you never know whether it's the side effects to the medicine or the original illness.
So true. And that's in something that your specialty is, which is, mood disorders and different things that are psychological. But even, as a senior citizen now, I have to say, I personally take exactly 0 medications, but most people I know are on 5 or 6 for everything. They're all on high blood pressure and they're all on statins, and then they have digestive difficulties because of that. So they're on, hydrochloric acid sequesters, on, and they do not get better. You do not move towards a state of health. Absolutely.
It's the same, just symptomatic Band-Aid medicine that really does not present, whether it's a chronic medical or psychiatric illness, an opportunity for recovery and for healing.
Well, let me reintroduce you so people can find you and your wonderful information in the future. I want to remind you that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse. And today we are so happy to have as our guest Dr. James Greenblatt, who is a knowledgeable physician in the field of integrative medicine. And today we're talking, just letting you know, he also has a new book, but he has other books too. This book is about answers to anorexia, Master the Balance of Hope and Healing. I love that, the balance of hope and healing. You can find out more at psychiatryredefined.org or facebook.com James Greenblatt, MD, and we will have links to all of that on our show archive, so you can always visit us there. So, Dr. Greenblatt, how do you find out about these nutritional deficiencies? Nobody ever tests me for any. Well, they do, because I go to holistic physicians, but let's say our listeners.
Well, I think the most important thing, and that's why we're focused on this educational platform, is training doctors, helping them understand the science and the clinical implications of testing for vitamin B12 and vitamin D is involved in in brain function that people just don't think about, and looking at the gut and looking at other ways of assessing nutritional deficiencies. It just has to be incorporated into standard psychiatric practice, and it's slowly happening as more young psychiatrists are more involved in understanding this material.
So, in other words, how do you do the tests? Are these just simple blood tests, or do you have to go to a special kind of doctor to get them?
So much can be learned through a simple blood test. Absolutely.
Because I know with what we like to do is go actually a little deeper into the metabolic pathways through something like an amino acid, organic acid test. But those are usually not something that would be available in a regular blood work situation.
Yes. I mean, I think the way our practice is set up and what we're training doctors is to kind of understand the basics. So that would be a simple lab work looking at iron deficiency and zinc deficiency and B12 and vitamin D and thyroid. But also a consultation in our practice involves the tests that you mentioned. We look at organic acids and amino acids and essential fatty acids, because many of the patients we're seeing have suffered and struggled, went to many doctors, hadn't got better. So we need a kind of large, a bigger workup to be able to ascertain why they're not getting better and how to help.
So that's a wonderful step approach. Like first, I actually think everybody in their yearly physical should be tested for some of those basic nutrients that you're talking about. Why not? It's not expensive to do vitamin D, even 25 hydroxy vitamin D. I think it should be regularly ordered, maybe not every year, especially if someone doesn't have any symptoms, but every few years. People should know that it's more important than that, what they say about a cholesterol number, and then they put everybody on cholesterol meds.
The research, and again, new research keeps coming out, but everyone's talking about inflammation. So we have new studies that just came out that if we look at inflammation markers, if they're elevated, we can predict higher rates of depression in a couple years. So there's a preventative model that could be utilized in our mental health treatment that's just never explored by our primary care doctors or our psychiatrists.
Well, maybe it will be, that's why you've taken the time to write all these books and have a school where other doctors can learn about these things. And it's so much easier now because, like you said, it's evidence-based.
That is absolutely true. And the research is probably not as robust as we would like because there's no financial incentives. Most of the research is funded by pharmaceutical companies to prove that their drugs work. And some of these nutrients cost literally pennies a day. So there's no financial incentive to do the extensive research that many people would want.
That's true. But also when we look at those studies, and of course you and I have looked, but now with everything being online, when I was young, I spent one day a week in the medical library, because I've always been interested in this. And I had to pass through the library because I was a student. So you had to actually get the physical journal. And I used to find all the articles about this stuff. And then I'm sure you may remember Xerox machine. So I Xeroxed those things. I made my own pile at home. But who has to do that now? Any one of our listeners can go on PubMed and look up zinc for mental health. And, the only problem will be 20,000 articles will come up and you may want to, filter it a little bit for what you're looking at. It's so widely available. I just can't imagine how much longer the pharmaceuticals can have a chokehold on this information, because when you're looking at the studies about the pharmaceutical drugs, they can often move a measured endpoint. That's true. Effectively and sometimes more quickly than nutrition. But when you look at the adverse effects and the overall health of the individual, it's terrible.
The literature is quite clear, as you said, to really support changing this model, fundamentally changing our treatment of mental health and mental illness. And it's just up to us to keep yelling and screaming till clinicians understand and patients demand better treatment.
Well, let's hope you can get this information through because, one thing, that has been disturbing me in terms of the COVID model is that they're actually going after doctors who do speak about the evidence of perhaps, you can get a vaccination too, but using certain nutritional supplements that might be antiviral. And you're not allowed to even talk about that.
Yes, it has been quite distressing, and it's been going on for many, many years. Doctors that don't understand will just kind of push the term, the best term being an alternative treatment, the worst term being quacks, into areas of medicine that they just don't know. And usually these doctors that are very critical, it's only when their health fails or their child gets a major mental illness where all of a sudden that they start looking themselves. And I've had doctors who didn't believe anything in nutrition who end up seeing me, bringing their kids to see us. And when they see the difference, they now can appreciate that a nutritional foundation is critical for brain health.
Yes. And then like I talked about before, your kind of intervention may help the direct symptom that might have been the initiating thing that someone was reaching out for. And then the side effect is that your hair is more lustrous. You get rid of your eczema, when you start doing fatty acids. Even if you're doing it for brain health, it still helps your skin too, right? So they see that change. So
Yes.
Not only would a child be, let's say, more calm and their learning improves, but they also look healthier and feel healthier. So that's the amazing thing to me, why there is any pushback. I think it's like you said, it's not science motivated. It's only money motivated because the only one who stands to lose here. And you know what? The pharmaceuticals don't stand to lose so much because they're not so dumb either. They have lots of research money. They've been buying up the nutraceutical companies because they know the shift is coming. So that way they make money either way. Okay.
Yes, it's a strange world. And, the end result, our patients are suffering as people are kind of fighting over the money and the lack of research. And again, so much of the information in integrative medicine, particularly for mental illness, are safe and can be utilized with medication. It's not an either or.
So I'm finding it interesting that you mention in terms of anorexia and your book, one particular supplement, which is zinc, because zinc is being touted as something that really helps with viruses as well right now. But there are very interesting tests in terms of zinc status. I remember we had one where you swish a zinc liquid in your mouth, and depending on if you taste it or not, or sometimes the iodine, putting it on the skin, you can do a simple test to look at how much you might have available.
Yeah, our taste buds are zinc-dependent enzymes, so lack of taste is one of the common signs of zinc deficiency, and we see that a lot in the elderly who are depressed, and we see it in our patients with anorexia nervosa who are malnourished. So one of the tests has been over the years just kind of swishing a solution of zinc sulfate in your mouth, and it should have a strong metallic taste if you have adequate zinc. But if it tastes like water, you're zinc deficient, and we use that for many, many years as a very quick called a zinc taste test to help ascertain zinc deficiency.
So that's, something that's very inexpensive, as you said. And of course, people with anorexia in particular are nutritionally deficient. So that's a pretty good model. But how do you get them to eat more, psychologically?
I think, the challenge over the years is either parents or treaters kind of using the model of just eat more and you'll be okay. Because anorexia is a brain-based illness, it's a distorted thought process. So we need to kind of help fix the thinking first, and the nutritional repletion, be it zinc, essential fatty acids, B vitamins, that'll help our patients feel better, less anxious, less digestive difficulties. And when that happens, they're just naturally better able to participate in the therapy to restore weight. It can't just be eat more, because their brain literally is telling them they're obese and they're going to die if they eat more.
I know. Many of them, they're so thin, but they're perceiving themselves as really overweight. Somebody might have told them that once when they were a child. But that's a complicated issue that requires a psychiatrist. Now, are you still seeing clients one-on-one?
I'm consulting to doctors primarily and teaching doctors, but I'm working on this unique opportunity with a group we should know in a couple of weeks about setting up a national clinic, a virtual clinic on a functional integrative approach to depression and anxiety. So we'll have clinicians around the country trained in this model to be able to offer direct support to patients who are struggling with depression and anxiety.
And I also think telemedicine has been a big boon to that kind of interaction. Have you found that to be the case, so people can access knowledgeable physicians anywhere?
Yes, that's why we're setting up this national program, so people who are in areas where they're not clinicians, or they drive 4 hours, pay $1,000, and that person is not well trained in mental illness. So this will kind of offer, well-trained clinicians to support patients looking for this integrative approach.
That has been a real boon, I think. Everything has two sides to it, and as horrible as, the COVID situation has been, I think because the telemedicine could have been available years ago, but there were all regulatory concerns, which were kind of dropped during that period of time.
Yes, no, it's been made, certainly getting through COVID, but it's really kind of opened up many doors for individuals accessing high quality integrative medicine.
Well, we have come to the end of our time together, but I do want people to know that you can find Dr. James Greenblatt. He's written many books, and his new book is Answers to Anorexia, Master the Balance of Hope and Healing. What a beautiful name there, Dr. Greenblatt. And thank you so much for being our guest today.
Thank you, Ellen, for inviting me, and keep up the good work. I appreciate the work you're doing.
And thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.